Hi, Amy. Welcome.
Hello, thank you.
Oh, hi,
Good
Amy.
to be here. Hi.
Welcome.
Good timing, just on time, hey?
Yeah,
Yep,
no, that's good.
Yep. Thanks for coming in tonight, or logging in tonight.
Yeah, no worries.
Liz, can you do a background, please?
Yes. Well, hi, Amy. It's Liz here.
Hello.
Thank you very much for
Good to
accepting our
virtually
invitation.
meet.
Thank you very
No
much. It's
worries.
nice to put name to the face.
Yeah, that's it.
Thank you so much. The only introduction I'm going to do, I was going to keep it brief because you have lots to talk about. But before you came on, we were just speaking amongst ourselves, and we were saying how great, you know, that we've been donating to you guys since 2007. I recall in my head, way before you were probably even
Yeah,
born.
that's it. Before me.
And our president then, Ken Hall, was a big advocate for the inner south community health, and he was always putting his hand up for checks and getting people wheelchairs and bedding and food. Fantastic. And we just want to know from yourself, you know, the change of name in Star Health. And as you know, we still donate to you guys, and we just love the work that you're doing. And so it's so good that you can come on board and give us an insight of what's been happening.
Yeah, no, I'm excited to be here, and we definitely, I know the allied health staff and teams are so thankful and reliant on a lot of the donations and things that we get from the different Rotary in the community. So, yeah,
You have a
I think that we have.
Amy, at all, or
Pardon?
you have a PowerPoint or anything?
No, I don't. I was just going to speak a little bit more informally, if that's all right. And yeah, definitely keep it nice and informal. So anyone's welcome to jump in at any time if you've got any questions. But I suppose I'll just give, a bit of an overview of, you know.
Well, I'll be rude and cut everybody off so they can't interrupt. However, people, if you do wish to say something, you know, you can press the space bar if that's easy for you. Don't ask me how you do it on an iPad. Shoot. Go ahead.
Yeah, great. Well, yeah, thanks so much again for having me on here at your meeting. I was a few months ago, I think it was Rotary Paran, I joined in at their meeting and did a similar thing as well. So it's exciting to get to know a few more people from across the different Rotaries. But yeah, so I suppose, so my name is Amy. So I work, as Liz said, at Star Health, and my position at Star Health is in the health promotion team. So I'll talk to you a little bit later about the kind of work that we're doing in the health promotion team specifically. But for a little more general, I guess, Star Health, we're essentially the local community health service, mainly looking at the cities of Port Phillip and Stonnington. So for those of you that might have been in the area for a little while or part of Rotary for a while now, you probably remember that we did used to be called Inner South Community Health. And so a few years ago, back in about 2017, I think it was, the name changed to Star Health, and that was kind of just in line with a lot of changes that have been happening in the community health sector. And it was essentially just a way to make sure that, you know, our services weren't necessarily defined just to people within the inner south. Obviously, these population groups are our priority, but it was kind of just extending the reach to show that, you know, anyone's welcome and available to attend our services. So for those of you that aren't really aware, pretty much what community health services are is we're here to essentially provide primary health care to our community. So mainly Port Phillip and Stonnington, as I said. And we're really here, I guess, for the most vulnerable and disadvantaged cohorts of our community. So most of our clients are people that are suffering disadvantage in some sense. And, you know, people that are potentially unable to attend, you know, other private kind of health services or things like that for different barriers such as finance and things like that. So at Star Health, even every time I have to think about what we do, we do so many different things and have so many different services and organisations and things. So I'm sure I'm going to forget a few as I start listing them off. But obviously, being primary health service, we offer different services. So like GP, dental, they're probably our two big ones where we get most of our clients coming in. But we've also got allied health teams. So that's our things like our physiotherapists, dietitians, occupational therapists, speech therapists. Sounds like I need one myself. We've also got lots of different mental health and counselling teams. So we've got social workers, people that do counselling and for specific reasons as well. So whether that's mental health or family counselling, counselling specifically for men as well. We've got a child, youth and family team, so they offer, you know, those kind of allied health services as well, specifically for children and their families. And we've also got Indigenous health teams as well, so working with Indigenous members in our community and making services and linkages a bit more accessible for them. We've also got community health nurses as well, so they can go and do home visits and things like that with families. We've also got quite a big volunteering and consumer representative service at Star Health. So a lot of our past clients and things, particularly who have been working closely with social workers or their counsellors, often they come and join Star Health as a volunteer after they've gone through their treatment or casework. And that's a really good way of, you know, keeping these people connected in the community and feel like they're giving back and helping out with some of the other work and things that we're doing at Star Health. And then we've also got the consumer board and consumer representatives. So they kind of sit on lots of our different working groups that we have at Star Health. So some of those groups include things like gender equity and health literacy. So we have a combination of staff on those groups and consumers on those groups, because at the end of the day, we want to make sure that the voices of our consumers are heard and make sure that all our services and things are nice and safe and accessible and inclusive for the people that are accessing our services. So that's really great. Now we also have a health promotion team at Star Health, which is where I sit on, as I said. So I guess probably where the main difference is between our health promotion team and some of our other services at Star Health is that we're kind of a bit more prevention focused. So where, you know, our allied health teams and GPs and things are intervention and doing that one-on-one kind of work with clients. Our work's more around preventing, you know, illness from occurring in the first place. So we're usually working mainly on different programs and initiatives and usually working in particular settings rather than working with a person one-on-one. So for example, my role in the health promotion team is mainly in the space of healthy eating and oral health. So most of the settings that I work with include things like early learning services and primary schools across Port Phillip and Stonnington. And so a lot of the work that we're doing is, you know, trying to bring a whole of service approach to health and wellbeing to these centres. So what we mean by a whole of service approach is, you know, we're kind of looking at all the different factors that you can look at or tap into that can help promote health within that setting. So in terms of healthy eating and oral health, that looks like working with these services on, you know, creating healthy menus for their early learning centres and long day cares, looking at policies and making sure that they've got policies around good nutrition in their centre, making sure the staff feel supported and, you know, knowledgeable around what nutrition is and what good nutrition is for the children at their services, and then making sure as well that the children are getting that information and their families, and then also linking in with, you know, different community settings as well. So that includes those like ours, so making sure that you know, they know that they can access dietitians if they think they need any further follow-up for children. Dental as well, our dental team go and do free outreach screenings to early learning centres and some primary schools, which is a really great initiative. And there's also lots of other work. So obviously I'm kind of mainly focused on healthy eating and oral health at Star Health in the health promotion team. But lots of our other employees in the health promotion team are working on different kind of health areas. So we've got a few people that are working on gender equity. And again, so that's with early learning services as well. So they do different things like making sure, you know, the books and things like that at the early learning centres are, you know, not gender stereotyped and kind of show that, you know, we can all grow up and be whoever we want to be and express ourselves in whichever way that we like. Mm-hmm. We've got some other people in the health promotion team working kind of in the youth space, so around drugs and alcohol. So there's a program in Stonnington called CTC Stonnington, or Communities That Care Stonnington, which some of you might have heard of. And that brings together a whole bunch of different organisations within Stonnington that work with youth and children and families so that they can kind of build on initiatives together rather than each of our organisations trying to work in the space individually. There's also probably more relevant to our area in Port Phillip. Some of you might be aware there's a project called, it's a bit of a tongue twister, it's the South Melbourne Community Capacity Building Initiative. And so that's working with the public housing estates in South Melbourne, so Park Towers and then also the high rises in Dorcas Street. So that's been a joint kind of partnership with the Department of Health and Human Services. And with that project, they've kind of just been trying to make the high-rise towers there a little bit more welcoming and inclusive to all members of the community, and in particular the tenants. And also trying to, you know, make it a bit more easier for them to access some of the services and things that we have at Star Health, because that's often where a lot of our clients are coming from. So some of the things that they've introduced there recently include, you know, creating a committee for the tenants that are there so that they catch up. I think it's about once a month and talk about any issues or things that might be happening in their buildings. And as part of that, which has been really great, obviously given COVID and we've been unable to do those face-to-face meetings and things like that, you know, part of the project involved making sure that there was access to, you know, iPads and Wi-Fi and things like that set up at the towers for them, which has been really positive. Yeah, that's probably our health promotion work in a nutshell there. And I guess maybe a good thing to touch on now as well is kind of, I guess, what our services are looking like in the context of COVID at the moment. So
Yes.
obviously, yeah, most of our services, as you know, would be face-to-face, like those client appointments and things like that. But we've also obviously got the responsibility to help slow the transmission of COVID, being a health service as well. So since March, a lot of our services have gone to telehealth. So we're trying essentially to, you know, prevent people from coming into the service if they don't necessarily need to. So that's been that's involved, I suppose, transferring a lot of our clients over to telehealth appointments. So whether that's just a phone call or through things like Zoom, which has worked quite well. According to a lot of our different teams, a lot of their clients have, you know, picked up on that technology quite well and are enjoying the telehealth appointments. So it works well, I suppose, for some services like GP or like dietitians, where you don't really need that physical kind of touch or anything. But it has been a bit trickier for some services such as physiotherapy and podiatry, where essentially the treatment is, you know, needing to, you know, touch a client or, you know, maneuver them and things like that. So we still are taking clients in at the service, but there has been that kind of, you know, they're trying to do it for the priority clients. So clients that definitely need to come in or have a health issue that definitely needs attending to immediately. They're the ones that we're kind of seeing as priority.
Whereabouts do they go to?
Yeah, that's a good question. Sorry, I should have mentioned at Star Health, obviously, as I said, we service the cities of Port Phillip and Stonnington. That means we've got quite a few different sites across the board. So our biggest sites where we offer, say, like our GP and allied health and dental are our sites in South Melbourne. So we're right across the road from the South Melbourne market. And then we've also got our other big site in Prahran, which is just kind of comes right off Chapel Street. So it's nearly the corner of Melbourne Road and Chapel Street, across from the big housing estate there, the Horace Petty estate. And then we've also got some smaller sites in St Kilda, so on Fitzroy Street. That's probably the other closest one to Albert Park. And then also a service in Bentley as well, which is a little bit out of the area, but they do a lot of work with some of the other alcohol and drug teams that, you know, service kind of the Bayside region overall. Yeah, so the clients have been able to come in mainly to our Prahran and South Melbourne and St Kilda Fitzroy Street sites for the time being. And obviously upholding to a lot of the COVID practices and things. So our services look a lot different to what they used to when you walk in the front door. We've got lots of, you know, the screens set up in front of reception and all the hand sanitizer everywhere and face masks and things like that. So it's all looking like a bit of a different world. And then unfortunately, you've got some other people like our health promotion team who don't have that, say, one-on-one client facing kind of roles. We've all been working remotely since since March, so it's crazy. It's gone on for so long now. So yeah, definitely I'd say that probably about 70 or 80% of the workforce are working from home now. Yeah. Probably also to note as well in our COVID response, again in partnership with Department of Health and Human Services, we've been doing some of the actual screening clinics for COVID.
Oh, yes.
So we've got we're kind of the main screening clinic as well as Alfred Health for Stonnington. So at Prahran Town Hall, there's a 7-day-a-week screening clinic situated there, which is a combination of employees from Star Health, some of our nurses and reception team. But the project's kind of got a little bit bigger now, obviously with COVID not getting too much better. So they've got like a few external people and things that have been employed to help out with the COVID response. And there's also some mobile testing screening clinics as well that are going around through Port Phillip and Stonnington. So that's pretty much, you know, they're housing themselves at the housing estate. So usually about a roster kind of comes out every week, and say like once a week they'll be positioned at a different housing estate. So, you know, one day in the week they'll be at Park Towers to do screenings for the tenants there. And also at Access Health in St Kilda, one day a week we're usually there as well to do the screening. So again, it's just trying to make the screening a little bit more accessible for those people that might not otherwise be able to leave their houses or get out too much in the community to go to the actual screening clinic site.
And how do people get referred to you?
Yeah, so our referrals, a lot of them come from, particularly for like the children, a lot of the referrals come from, say, like maternal and child health. And the different early learning centres and schools and things. Otherwise, people can self-refer into the clinics as well, to any of our allied health and, you know, GP and dental. But we also get a lot of referrals too from Dental Health Services Victoria, particularly for dental. They kind of refer people onto their local public dental agency. And lots of referrals from other organisations as well. So places like your Access Health in St Kilda and different social residential settings and services as well in the community. So yeah, Star Health's pretty good at partnering with a lot of the different, you know, organisations and things out there that help similar clientele and client groups. Probably to mention as well, a big referrer is the Alfred Hospital. So it's kind of, I suppose, once people have gone through their, you know, acute condition or things like that, and they've gone back into the community after recovering from a particular illness or whatnot, often it's community health and Star Health where the clients will get, you know, recommended for their follow-up and kind of longer term rehabilitation and treatment. Hello.
Just laughing at the babe.
So cute.
You're very quick, Kim, getting your mute then. And you did. Sorry, I'm asking all the questions.
No, that's good. I was just about to say, I think it's pretty much covered what I was going to. So throw your questions at me.
You did mention Indigenous health. Is where do those people come from?
Yeah, so with our Indigenous health team, to be honest, I'm not 100% sure where our kind of referrals or things like that come from particularly. But the Indigenous health team, they're kind of located more at our St Kilda site, so in that St Kilda area. And often a lot of that work is outreach as well. So, you know, it can be going out to Veg Out where they have an Indigenous barbecue there. I think it's maybe once a month or so. Also, we have a barbecue that Star Health hosts as well, where we bring a lot of volunteers, and that's put on for the Indigenous community as well in that's in St Kilda in Mitford Street. So they call it the Womanjeka barbecue. And I think as well, the Indigenous health team often go out to some of those other specific Indigenous health clinics and centres as well. So kind of visiting their groups and organisations they're already going to, rather than trying to make them come to see us.
Well, I've sort of done my 3 questions. Are there any more questions?
You go for, I think I see Kim's got her hand up.
Yeah, I have just about the dental stuff, obviously, drive everyone else insane a bit. But with your homeless, sort of food insecure, those kind of people, do they have to give you their proper name? Like, do you get a Medicare rebate from that? Or, you know, like a lot of homeless people don't actually want to be called by a particular official name. They'll just be called whatever their nickname is. How do you guys?
Yeah, of course. That's a really good question. And to be honest, I'm not 100% sure what the answer to that is. I can definitely follow up with the dental team for you. But my understanding is that Star Health have quite a good relationship with, say, Access Health in St Kilda, who service a lot of people that are experiencing homelessness or have experienced homelessness in the past. And often, you know, we kind of work quite closely with their caseworkers and things like that. So it's often the caseworker that might make the appointment for their homeless client, and they'll come into the service and bring them as well to their appointment with them. But yeah, in terms of the more specifics and names and things like that that get used, I'm not 100% sure, but I can definitely follow that up for you.
Pam?
I was just going to say, I'd love it if you could.
Yeah,
Sorry,
definitely.
we've got a few words here now, guys. Okay, I'll just go on mute. Sorry, I'll ask later.
You're all right.
Sorry, Pam?
Thanks, Richard. Look, this might come on the back of the question you've just been asked, but in the area that we're talking about, the city of Port Phillip and Stonnington, we have a large number of international students who may not carry Medicare cards and who rely heavily on community pantries.
Yeah.
Are you able to service their medical needs, or, as the previous question, does it rely on a Medicare card?
Yeah. Look, I think potentially for dental, I'm not too sure, but I think there might need to be a Medicare card involved with that, or some kind of a concession card or healthcare card or something of the sort. But yeah, no, that is a really good question. Again, something that I'm happy to follow up for you on, particularly across the board with all of our services as well. I'm sure it's kind of that tricky thing where each different service kind of has its own specific criteria or requirements depending on who the funder is for the service. But,
so the Albert Park have a really good relationship with the Port Phillip Community Group, as do we. We have a relationship with Empower Community Pantry on City Road.
Yeah.
And I think predominantly the numbers that go through there are our international students and our refugee students. So I think, you know, it'd be wonderful if we could perhaps find out where these people could go to receive medical care.
Yeah. And good to touch on that as well, I suppose, is that our services are fairly low cost compared to, say, your private providers and things like that. So most allied health appointments will set someone back about $10 an appointment. But at Star Health as well, we also won't refuse service if someone can't afford it. So often we do have a lot of our clients that are coming through, you know, not having to pay a fee at all for their consults and things like that.
Ian?
Okay, thanks. Aimee, can I roll this back to the very beginning?
Yeah.
What type of organisation is it? Is Star Health an NGO? Who funds it? You know, it sounds, the provision of all the services sound brilliant, but it can't all come on Medicare. Somebody's got to be behind it.
Yeah, you're right. So technically we are a not-for-profit organisation, and we can be considered as like a charitable organisation or whatnot. However, most of our funding does come through from state government. So even though we're kind of like a non-government organisation, we do get a lot of our funding from the state government. And it's very different for all our different services as well. So for example, we also, I don't think I've mentioned it, we do NDIS as well. So we're NDIS providers. So, you know, we get our funding from that side of things as well. With the dental team, we pretty much get our funding from Dental Health Services Victoria. So they're kind of like the leading public dental health agency, who again are funded through government. For our health promotion team, we kind of receive block funding from the Department of Health and Human Services. So again, kind of like the Victoria division of your Department of Health.
Okay. Yeah. And your dentists, the doctors, etc.
Yeah.
Who pays for them? Is it a bulk billing type situation where it basically just gets billed through? Are the doctors and dentists employed, or do they come and go from their separate practices?
Yeah, that makes sense. No, pretty much all the employees at Star Health are essentially employed as Star Health employees. So, you know, receiving a base wage or something like that, not based on what is coming through Medicare rebates or things like that. Most of our clients as well don't even come through the Medicare program in terms of your allied health, because the appointments are only like your $10 or whatnot, or for free if they can't afford it. So yeah, usually Medicare, you see a little bit more referrals and things like that through the private sector. Yeah.
So how big is the organisation?
Yeah, relatively big. I think we're big, but some other people might not. But I think at the moment, we're about 350 to 400 employees.
That's big.
Yeah, and across, again, a lot of our team are part-time as well. So you might find like a lot of our allied health team work only a few days at Star Health, but usually there's someone on each of the days, if that makes sense. A mix of, flexible working arrangements and things like that, which is probably why we're so big.
Cool.
I mentioned before that, we're kind of all employed under Star Health, but there are some exceptions, or some of our programs and services that we offer might be in partnership with another organisation, but for the purposes of having like a particular employee, they'll come under Star Health. So that's kind of similar to that South Melbourne capacity building initiative that I mentioned, working with Department of Health and Human Services at the high-rise towers. That's kind of a program that DHHS said that they want to happen in the community, and then they've asked Star Health, can we kind of lead it? In case we've kind of had to employ the staff to do that program.
And what's the structure? There's got to be I'm assuming there's a CEO.
Yeah, so
what's her name?
So our CEO is actually called Damien Ferry.
I was hoping you were going to say, yes, her name is. But
I know, we all are hoping that actually. Our team at Star Health are doing a lot of good work around gender equity internally, as well as externally, which has been really interesting. So Damien Ferry he's been our CEO for quite a while now, I think. He's been here since I started back in 2017. He was actually away for just over 6 months. He'd gone to North Richmond Community Health. So he had to stand in as the acting CEO there. I'm not sure if any of you are aware, there was a bit of a debacle that kind of happened at North Richmond Community Health. They're the organisation that's in control of the safe injecting rooms and sites in Richmond. Yeah, so they had a bit of trouble there in the past. So Damien had to step in to kind of bring everything back together for them. And he's only just rejoined us again at Star Health in the past 2 weeks, I think it was. Yeah. So with our structure, we've kind of got the CEO, which is Damien. Then we've got like general manager. Then we have program managers, and that's kind of just like a combination of the teams under a program. So I think, for example, our health promotion team sit with the alcohol and other drug team. Then we've got like an allied health program manager, and then a program manager for your mental health and counselling. And then under those program managers, we kind of have individual coordinators for the team. So we've got, a health promotion coordinator that oversees all our health promotion officers.
There have been discussions about a drug injection centre near South Melbourne markets. Have you been involved in that? Not you personally.
Yeah, not me personally, but I would imagine that we probably have been, to be honest, because we've got an outreach team that kind of do drug and alcohol work in the evening. So they go around driving to the different places where people might be experiencing homelessness and kind of provide support and clean needles and things like that for the community. At all of our Star Health sites as well, we do have the yellow disposable bins where people can safely dispose of their needles and things like that. So given that we're right across from South Melbourne Market and have one of those already on our building, I'm sure there's someone that's been in conversations about that happening at South Melbourne Market.
All right, a bit more then, all from me. Nobody's asked any questions. Orange Sky operate out of the North Richmond Health Centre, for want of a better words. Where do they operate in? They operate in South Melbourne, don't they?
I'm not sure. Orange Sky, what do they do?
Sorry, I thought you would know them. They have portable showers and dishwashers. Clothes washing.
Okay, yeah.
Okay, it's all right.
Yeah, no, I'm not sure. I've not heard of them before. I haven't seen them come up in any of our emails and things, but yeah.
They operate out of Father Bob's place, but I didn't know whereabouts they went. Okay, forget that question. I thought no. Anybody else have any queries? Vicky, you'll have to turn your mute off.
I know they operate in other places, but Orange Sky also operate at St Silas Church.
Oh, do they?
And, yeah, when the meals are on, yeah, when they're doing their Sunday suppers. I don't know how long that's been going on, but they've been there when we've been there.
Vicky, sorry, Kim again?
Sorry, I was just wondering, Aimee, if I could take it offline with you, but so our Rotary Club and I headed up where we've got a dental charity called Solar Smiles Dental Charity.
Oh, cool, yep.
And we're rolling out a local arm that we're going to be working initially with St Silas, which is what Vicky was talking about.
Yep.
I'd love to be able to speak to someone in your dental team just to find out some of the logistics about how you guys go about it compared to, I guess, how we're going to think about rolling it out. It's always better to find out pitfalls before you get there.
Yeah, that's it. Yeah, definitely. I'm happy to put you in touch with someone from dental. Yeah, to discuss that.
That would be lovely.
Yeah.
Thank you.
Yeah, beautiful. And I'm sure that would be great as well. I'm sure our dental team would love to know what else is going on in the community so that they can, refer people, to things like that as well. If people need that extra.
So I'm guessing when you talk about Health Services Victoria, you're talking about Dr. Martin Hall's team?
Oh, I'm not too sure. No.
Sorry, he's a friend of mine from Timor, but he also heads up Health Services Victoria, so I thought you might know.
Okay, yeah, no, I'm really more familiar with Dental Health Services Victoria, more specifically. I'm not too sure.
No, he's the head. He's the head guy there.
Yeah, right.
But that's okay. That's all right. It's all good. Thanks.
Well, are there any more questions from anybody? You'll have to unmute yourselves. Heidi, have a go.
Yeah, really great work what you do, Aimee. I was actually really interested in the fact that you do health promotion in schools, and I had wondered, because you do healthy eating and oral health, have you heard of the Achievement Program?
Yeah, I have. That's pretty much one of the programs that we're working through. Yeah, so
I thought there was a really good crossover there for you guys if you didn't know about it already, and of course, it's Department of Health funded through Cancer Council Victoria. I used to work with that team, so I thought, oh God, if you don't know about them, you probably should look it up.
Yeah, no. So yeah, we kind of use existing frameworks and programs within our health promotion team as well that are statewide. So Achievement Program, it's kind of how we try to work with our early learning and primary schools. Yeah. And also another program called Smiles for Miles, which is linked in with Dental Health Services Victoria as well. So that's my main work, is rolling out Smiles for Miles. Yeah.
Fabulous. Good work. That's all I wanted to check.
The Achievement Program's gone heaps of new updates recently. I'm not too sure if you've seen it. It's a big refresh and it's all online now. So it's a lot more manageable for...
Definitely a very complex program to get all your marks through, but it's definitely worth it.
Yeah, absolutely. Yeah.
I've got another question.
Yeah.
Richard, it's for you.
Oh, right. Yes, Ian.
Okay, so we've given the club's given some money to Star Health.
Yep.
What's it for?
Mostly what we do, we deal with Gemma. Can't think of her surname, sorry.
I think she's in our mental health team, Gemma. Yeah.
But what a lot of the money we give for is specific client-directed items, such as a couple of $100 here or there for shoes or for food. If you care to look at the last newsletter bulletin, you'll see that there is a entry there for what we just gave them, and attached to that is a list of all the, I'll say basically all the people that money has been distributed to. It's all been anonymised, if that's a verb.
Yeah.
But it gives you an idea of the type of detailed work that they do. It covers, buying somebody a pair of shoes or buying a microwave or that type of stuff. And we've been doing it now, as Liz said, for a decade-ish. I haven't been involved that long, but I know over the last 5 years, it's been something like about $5,000 a year. And last year, that is up to June, we actually gave them $9,000 because it was a bad year. A couple of weeks ago, we gave them $1,500, but it was sort of the beginning of the year. We give them money on a quarterly basis.
Yeah,
So
so
if
maybe
you,
we're definitely so thankful for all those donations. I know I'm not being client facing, like I don't have to ever apply for any of that funding, but
yeah,
I know our allied health staff love it, and it's so helpful for our clients because, you know, even it's so funny, like a particular, you know, healthcare worker will be ordering it for something totally different to what their normal role is. Like I know for our dietitians, for example, obviously working with clients on diet and exercise is a big factor as well. So I know dietitians that have, you know, applied for funding to get proper footwear for their clients so that they can then go out and exercise because they're not able to afford it. And that's a barrier for them if they've got particular issues with their feet. And then again, things like the microwaves as well. And cooking appliances are so beneficial for a lot of our clients.
Yeah, it's lots of things of about $100, $200-ish for a specific client for a specific purpose. So as I say, have a look at the last bulletin, or it's actually on our website too, if you ever look there. And there's an attachment showing where the money went last time. But it generally is for that specific purpose, not just, oh, here's some money, go and spend it.
No, that's exactly it. So what impresses me is the money goes an enormous way and impacts a whole raft of people. That's enormously worthwhile.
Yeah, a little bit of money goes a long way when it's in the right direction.
But I remember some of those. I remember some of those stories. We bought someone a wheelchair because she's never been able to leave her apartment there in Vic Ave, you know. And we bought one lady a bed who'd been sleeping in a chair for many years. We bought her a bed. She was so thankful. And those little letters came along along to us as appreciation. You know, they could hardly write, you know, and then Ken would read it out or someone in the club would read it. But just we're specific for people who make life changing, you know. Can never afford a $800 wheelchair, and here it was. So this person now has a life. It's just things like that, which is fantastic, you know, and it saved your organisation trying to find that funding too for one person. You know, we donated it to them, and it was a big lump sum. It was so good. And someone a fridge. Someone needed a fridge. Someone never had a fridge. I remember we bought them a fridge. So it was fantastic.
Yeah, no, it's great. As you said, it's often those really small kind of household things that you don't really think of, but it can make such a big difference to someone's life. And I know, I guess it's that great thing that, you know, the money's not, it's definitely going to the clients. Like the money's not just sitting within our organisation or anything. It's definitely, you know, being spent on particular items for clients. And even I know, I think in the past I've heard from some of the counsellors and social workers, sometimes it's, you know, funding to hire a cleaner to help someone in their public housing estate clean up their house because they've just felt so flat and not motivated to do anything or leave because they've just had, you know, all this mess around them. And then it's, you know, getting a vacuum or organising a cleaner to come help them for the day, and it can change, give them so much more purpose and motivation and things like that. It's great.
Aimee,
if you haven't noticed, I've just shared the last list, and you'll see, you know, $100 for this guy for a microwave, $200 for non-allergenic clothes. It's all very specific stuff.
Right.
So it's
So who actually makes the decision as to where it goes?
Gemma comes up with a list basically.
Yeah, I know from what I see from like the all staff emails, Gemma will let us all know once the funding has been provided or once Rotary has said that they will commit some funding, and then she asks people to kind of send in a reason, I suppose, from her clients to herself, and I suppose she probably shortlists it from there.
Yeah, well, this list actually, the list I get has more. It gives the name of the caseworker, like that, which of course we cut out. Yeah,
sure. But Richard, are you saying so? You actually get to see, and do you make? You know, does the club make a decision, or is it Gemma that makes the decision on where it's going to go and just advises you back and says, this is how it's been applied?
The latter, basically, yeah.
Cool.
Well, we don't have the expertise or the knowledge.
No.
So that's why we rely on her. I mean, she could be lying through her teeth, but I know she's not.
I'm sure she's not.
No.
Well, the trouble is if you do, the well eventually dries out. and it doesn't come back.
Yeah. You'll come to Star Health and we've just got microwaves and fridges everywhere in our office. We're all sporting new runners and
Wheelchairs.
stuff.
I wondered what that was behind the cupboard.
Yeah. Well, anyway, if nobody has any more questions, can I turn it over to you, Liz?
Yes,
Before we
thank
do, just a reminder that in 2 weeks' time, we've got our new DG, Philip Archer, will be actually holding a cluster meeting online. I don't know details, except it'll be at 6:30. The Zoom link should be the same. But anyway, Liz, if I can turn it back to you to wrap up for us, please.
Yes, thank you very much, Richard. Well, thank you very much, Aimee, for enlightening us. All that great work you guys are doing there. I didn't realise it was so intense and so involved. It's fantastic, and you're very
Yeah, lots
knowledgeable.
going
So
on.
thank you very much.
No worries. It's great
You know
to
it
be
all,
here.
even know the umbrella of the whole organisation, which I was impressed. You know, you even know who your
I know,
boss is,
it
which is
takes
good.
years to get your head around everything that's going on here at Star Health. So
But you've been there 3
love
years and you
working
know
here.
all the detail, which is fantastic. Thank you very much. And
I actually, fun fact, I started off as a volunteer and a student actually doing my placement at Star Health. So yeah, it just goes to show what a great organisation it is to work for, and really cares for its, you know, volunteers and employees and everyone that comes through the door.
well, on behalf of our whole organisation, Rotary Albert Park, we'd love to thank you very much for taking the time this evening to enlighten us. And we're so pleased that our money goes to a good cause. Thank you ever so much.
Yeah,
Keep up the great work.
Thank you. Yeah, and thanks for your ongoing partnership. I'm sure it's yeah, we've valued it over the years and even longer since I've been there. It sounds like it's been going on for ages. So yeah, really great stuff.
Thank you
And
very
of course,
much.
feel free to get in touch anytime if you've got any other questions about, you know, things that are going on, or anything you think we might be able to help any of your work doing in the community. So
Yeah, well,
Okay.
there's a couple of things we're looking at doing apart from the dental. There's a community pantry, maybe with you or with the Port Phillip community group.
Yeah, amazing. With our health promotion team has done a bit of work with the Port Phillip community group as well on the SHIP project. I'm not sure if you've heard of that, social health inclusion port, but yeah, we've got someone on our team, Danny, who does a lot of work with Port Phillip community group and a lot of their projects and things that they're doing too. So it'd be great to connect up.
Fantastic.
Aimee,
Thank you.
Aimee, another question for you, if you don't mind.
Yeah, go for it.
Mental health.
Yeah.
We're all locked down. We're told we're going to be locked down for another 6 weeks. Personally, I actually don't believe it. I don't think we're going to be locked down for 6 weeks. I think it's going to be till the end of the year, and that'll be for a start. That's unless somebody overthrows our dictator. But what is actually happening with people in the community? I hear 1,000 people have suicided. Of that, 50% is under 25. So what's actually happening? I mean, you're much closer to this than I am, but what's happening with our mental health?
Yeah, well, from what I've kind of heard through the organisation, it's kind of been a little bit of a mixed bag. I think a lot of our clients aren't on the extreme kind of chronic end of or like acute, I suppose, end of the spectrum. We're kind of seeing more people in the recovery space and things like that. But, you know, we've had some feedback that some people are doing really well, like people that have a lot of anxiety are actually loving not having to feel that they need to leave the house, or, you know, there's not too many people out when they go to the shops and things like that. But I know our kind of, you know, family violence teams are seeing a lot of increase in reporting and cases and things like that. And even just some of those typical ways of, like, it's really hard to do a telehealth consult with someone who's not feeling safe to talk about the issues in their own home, depending on who's around them. So yeah, there's that. And we've also had a lot of quite an influx in people that haven't accessed mental health support at all before in the community. So we've also been running like a COVID-19 hotline, which is pretty much for anyone in the community that feels that they're struggling from the effects of coronavirus. They can call up and speak to a counsellor, and lots of people, you know, professional workers or, you know, parents and things like that who haven't ever had, you know, mental health concerns in the past, and now it's kind of exacerbated it, being at home a lot more. So yeah, that's probably the dullest bit of information that I know, but yeah, I don't know too much higher into those statistics and things like that, but yeah, it's definitely what I'm hearing as well.
I think all of you who are on the front line are champions. You're really where the rubber hits the road. You're the saviours. You're the ones that are actually keeping things under wraps. I think it's fantastic.
Yeah, we've had a lot of work as well at Star Health recently, kind of on our own staff employee wellbeing too. So we've got a wellbeing working group we've formed just over the past few months to help make sure that our staff are feeling as supportive as possible, and a lot of those things as well with working remotely, just trying to make sure that people don't feel pressured, if they've got children at home that they're also teaching, like don't feel like you have to get 100% of your work done or you have to stick to your hours or things like that. So a lot more flexibility with our staff too, which is good. So yeah.
Thank you.
Ian, just a quick one. Sorry, 10 seconds. Because I work with Black Dog Institute. We're hearing that, so I'm a lived experience community presenter for them, Aimee. There's a lot of people now logging into like web-based apps and things for mental health and mindfulness, and they're going through the roof. And yes, suicide rates are soaring at the moment, unfortunately. I mean, if you need some more detail, I can go and get some for you. But yeah, from what Black Dog's doing, and when I do my CPD courses with them, yeah, it's not good at the moment. But there's a lot of mental health stuff coming out, and there's a lot of people bringing it out. So Beyond Blue, Black Dog, Sane, there's quite a lot. Headspace, there's a lot of apps coming out at the moment for mental health for support.
Yep.
Fantastic. Thank you, Aimee.
Thank you again, Aimee.
This evening. Thank you very much. Thank you very much.
Yeah.
Sorry we've gone over time with you, but thank you very much for enlightening us. It's been fantastic. Thank you.
No worries. It's been great to be here.
Thank you.
Do you have a few more things to wrap up for your meeting? I can duck off.
No, that's about it.
Richard, thanks.
Oh, beautiful.